I'm going to be talking about a novel educational experience that's designed for undergraduate students interested in emergency and wilderness medicine. This course takes place through the University of Colorado Department of Emergency Medicine. So we've noticed that pre-health students usually lack academic opportunities to participate in both medical and wilderness-based education experiences. And in parallel, we've also understood that an increasing number of people are pursuing outdoor activities, and they might lack the skill sets needed to keep safe in the backcountry. And we really wanted to design a course to give those students those valuable wilderness skill sets and also empower them to be able to evaluate potential healthcare careers. So in response, we developed a 2-week course at the University of Colorado Department of Emergency Medicine. It's open to all undergrad students interested in a pre-health career and also interested in learning wilderness skills. The goals were for students to gain basic medical knowledge. We wanted them to develop good wilderness and evacuation skills. We wanted them to be exposed to multiple healthcare careers and mentors, and we also wanted them to understand how to navigate through a competitive application process. So the first week takes place at the University of Colorado, and we break it down into 4 main disciplines of learning. First being lectures. Our lecture content ranges anywhere from basic medical knowledge to trauma management to how to do a good primary and secondary assessment, and we also touch on other environmental and wilderness medicine topics. With our skills labs, we really want to give students hands-on experience. We do a lab on wound care and suturing. We improvise orthopedic stabilization techniques. We spend a lot of time doing triage and disaster drills, and all of our students get CPR certified as they go through the course. Our career guidance portion is unique to the University of Colorado. Students get to sit down with physicians and discuss what makes a successful medical school interview. They also get to sit down with members of the Medical School Admissions Committee of Colorado and talk about how to make their application stand out amongst their peers. And we also have a career panel for them where they can sit down with different members of different healthcare practices and ask them about their trajectories and how they got to where they were. And our clinical experiences portion is really popular for the students. They get to shadow a physician in the emergency department. They also get to do a 5-hour ambulance ride-along with local EMS crews, and we've also designed some more case-based practice and clinical scenarios for them. And just as a visual, there's some pictures from the first week in town. The second week, we go up into the foothills and we spend some time camping and really practicing what we learned at the university. We really want the students to have a successful camping experience, so we teach them the basic camping skill sets that you need to know: how to set up a tent, how do you build a 1-match fire, how do you purify your water, and when appropriate in our winter course, we talk about snow shelters and avalanche safety. We do a lot of patient scenario practice up there, whether it's single victim or multiple victim. We have a wide array of backcountry trauma scenarios that we integrate pretty randomly throughout the course so students can practice what they learn. And we also do some rescue techniques. We teach them how to improvise litters and carriers and what it feels like to carry someone on a litter. We do some search and rescue drills, and we really focus in on developing those primary and secondary assessment techniques, as well as other stabilization and evacuation techniques. These are some pictures from the second week, just to give you a visual about how hands-on the students really are. So student feedback was significantly positive. They reported large gains in knowledge in both emergency and wilderness medicine, as well as the practice and profession of medicine as a whole. And in a separate data set, but in an effort to continuously modify our course, we asked the June 2015 course about what their thoughts were on the course, and they reported higher enjoyment levels, more knowledge gain, and also feeling more comfortable being able to apply their skills in a real-life scenario based off of our scenario and skill-based learning, and they preferred this over our lecture-based learning. So in conclusion, this novel educational approach really influences pre-medical students through both hospital and wilderness-based instruction, and at the same time we're simultaneously shaping their outlook on an ability to pursue a career in medicine. The success of these courses demonstrates a strong market demand for courses of this nature, and it shows a large area of growth for the